In this video, we're going to cover 8 potential foods and drinks that could be triggering your mouth ulcers, plus how to treat them and when you should consider seeing your doctor about your mouth ulcers. Now, certain foods can contribute to the development of mouth ulcers due to their acidic, spicy, or abrasive properties. And here are 8 common foods and drinks that could be triggering your mouth ulcers. So first of all are citrus fruits and juices. So things like oranges, lemons, limes, and grapefruits are highly acidic and they can irritate the lining of the mouth. And that can lead to ulcers in people who are sensitive to these. The second are tomatoes. So like citrus fruits, tomatoes are actually acidic and they can trigger mouth ulcers or they can make the existing ones worse. Thirdly are spicy foods. So foods with hot peppers or strong spices can again irritate the mouth's mucous membranes, potentially leading to ulcers. Fourthly are salty snacks. So foods like potato chips can be abrasive and they can create small injuries in the mouth which can then develop into ulcers. Fifthly is chocolate. Now, some people are actually sensitive to chocolate and that can lead to mouth ulcers, especially if they have existing mouth ulcers. Now, the next item is not a food item, but a drink. It's very popular and that is coffee. Now, coffee is acidic and it can irritate the mouth, particularly if ulcers are already present. Seventh are nuts and crunchy foods. Now, these foods can be rough on the mouth's lining. They can cause minor injuries that can then develop into ulcers. Now, finally is alcohol, and there's several reasons for why alcohol can cause mouth ulcers. Firstly, it can dry out the lining of the mouth and it can reduce saliva production, which normally helps to protect the mouth's delicate tissues. Now, this drying out effect can make the tissues in the mouth more susceptible to damage and ulcer formation. Now, additionally, the acidic nature of alcohol can lower the pH in your mouth, and that can lead to an environment that is more conducive to the development of ulcers. So now, in addition to these common foods, some people do have specific food sensitivities or allergies that can cause an immune response leading to ulcers. So now that we've covered 8 of the foods and drinks that can trigger mouth ulcers, well, what are potential treatment options? So the first are what we call topical treatments. These are those that you apply directly to the mouth ulcer itself. So first of all, you could try over-the-counter or OTC gels or ointments. So there are lots of branded products out there and you can speak to your pharmacist about the most appropriate ones, but the ingredients they contain are things like benzocaine or hydrogen peroxide, and these can provide pain relief and protect the ulcer from further irritation. You might also want to try antiseptic mouthwashes. So rinsing with a mouthwash containing antiseptics can help reduce inflammation and prevent secondary infections. Now, other people try home remedies, and whilst the evidence behind these is variable, it's worth mentioning them. So first of all could be a salt water rinse. A simple salt water rinse, so mixing salt with water, can help clean the ulcer and reduce inflammation. Baking soda can also help restore the pH balance and reduce pain, and some people like to apply honey, like Manuka honey, to the ulcer because of its healing properties and antibacterial properties. Other people have suggested aloe vera gel applied to the ulcer can soothe the area and accelerate healing. Now, a third important thing to mention are dietary changes in line with this video. So that means staying away from the acidic, spicy, and salty foods that can irritate the ulcers, like the ones we mentioned earlier, and drinking plenty of water to keep the mouth moist and aid in healing will also help. I'd also say avoid coffee and alcohol. Now, the final thing to mention is pain relief, because mouth ulcers can be incredibly painful. So over-the-counter pain relievers, so things like ibuprofen or acetaminophen, can help manage the pain. But again, check that it's suitable for you to take these medicines before taking them. Finally, when should you see your doctor about a mouth ulcer? Well, the good news is most mouth ulcers heal on their own within 1 to 2 weeks. But you should see a doctor if the ulcer is unusually large or painful, if it lasts longer than 3 weeks without signs of healing, you've got frequent recurrences of mouth ulcers, the ulcer is accompanied by other symptoms like a fever, diarrhea, or a skin rash, if you've got severe difficulty eating or drinking due to the ulcer, or if you suspect the ulcer is related to a medication that you're taking or an underlying health condition. Now, persistent or severe ulcers can be the sign of a more serious condition like a nutritional deficiency, an autoimmune disorder, or in very rare cases, oral cancer, and they do require medical evaluation.